Thalassemia is an inherited disorder of hemoglobin production. It is an autosomal recessive disease in which there is impaired synthesis of beta-globin chain. Beta chain are encoded by a single beta-globin gene located on chromosome 11. Failure to synthesize beta chain is the most common type of thalassemia, and it falls into two categories. Beta O, in which there is no beta globin chains are produced. Beta plus, in which there is reduced but detectable beta globin synthesis. Heterozygous have beta thalassemia minor, a condition in which there is usually mild anemia and little or no clinical disability. The anemia has microcytic hypochromic pattern. Homozygous have beta thalassemia major and are either unable to synthesize hemoglobin A or at best produce very little. It is further divided into major and intermediate. Now let's talk about the clinical features. Patient with thalassemia suffers from anemia. Defective synthesis of beta globin in the beta thalassemia contributes to anemia through two mechanisms. The first, by inadequate hemoglobin A formation, resulting in small, poorly hypochromic red cells, and the second is by allowing the accumulation of unpaired alpha globin chains, which form toxic precipitation that severely damage the membrane of red cells and erythroid precursors. Hepatosplenomegaly is caused by extramedullary hematobiosis and hyperplasia of mononuclear phagocytes. Thalassemic patients suffer also from growth retardation. They also have a unique facial features such as depressed nasal bridge, prominent mandible, and frontal bruising. Ineffective hematobiosis results in iron overload. Now we're gonna talk about investigations. Beta thalassemia is diagnosed by using hemoglobin electrophoresis. This test is going to show a reduction or a decrease or completely absence of hemoglobin A. It also shows an elevation in the levels of hemoglobin F and hemoglobin A2. Beta thalassemia major peripheral blood smears shows microcytosis associated with hypochromia. It also shows us target cells. Variation in cell size called bikilocytosis and variation in cell shape called anocytosis. Cure now is a possibility for selected children. Bone marrow transplantation is considered the treatment of choice. Thalassemic patients may also be given folic acid. Hydroxyurea is also given to increase fetal hemoglobin. Another treatment strategy is by using blood transfusion. Repeated transfusion can lead to iron overload, which is treated with chelating therapy. Splenectomy may be also indicated in thalasssemic patients.